On to another big story that we are following, and even as Karnataka witnesses a decline in cases, a worrying trend is emerging from the state. In fact, as per the Karnataka Health Commissioner, 50% of all COVID deaths in the state occur in less than 3 days after the patient is hospitalized. Data shows that Karnataka's COVID death rate is at 2.4%, which is almost twice the national average. Speaking to Mirror now, the state health department has said that ignorance, laxity, and delayed treatment are the main causes. In fact, people get themselves hospitalized only when their condition becomes very severe, which is a big concern for the health officials over there, and they say that this is a contributing factor to the high death rate.
Overall, we see around 40 to 50% of the deaths. Some districts it's a bit more. We have analyzed how many have happened within 24 hours, how many within 48 hours and 72 hours. So combined, the 72 hours thing is important because we need sufficient time to treat also for the hospitals. So people coming late, because usually what we have found is many of them go for local treatment. They treat it as a casual flu or a cold kind of a thing. They don't get it tested on time. Only when their symptoms deteriorate, they get breathless, then they panic and then come to a COVID hospital. By then, many of them have deteriorated quite rapidly. Sure. So the physicians also find it very tough to treat such cases.
Now, ignoring initial flu-like symptoms and not getting tested pose big risks. We spoke to a physician who admitted that local clinics fail to look at symptomatic patients as COVID suspects and prescribe normal fever medicine instead of recommending an RT-PCR test.
If he comes on the first or second day, we can give any symptomatic treatment, like if he has any running nose, we can give some levocetirizine, montelukast like that. Or if he has any fever, we can dolo. If he is very comfortable state. Comfortable means his temperature is below 98. If its saturation above 96, then only we can call him as a comfortable patient. He is not eligible for any test. It is on the, if he is coming on the 4th or 5th day, we are not supposed to treat in OPD basis. We have to send him for the center where they will do RT-PCR or antigen test or any COVID care center.
Now, citizens must understand the veracity of the situation and seek timely tests and treatment, says Dr. Prasanna, who's the president of the Private Hospitals and Nursing Association in the city. Apart from cracking down on unregistered clinics or quacks, people must also beware and seek proper medical help as soon as they face flu-like symptoms. Listen in.
People have become totally lax or due to phobia. They are all getting it treated at home. Thinking it's like a normal influenza or a flu. So these patients, when their oxygen saturation are dropping, then they are coming to the hospital and we are testing at the time of hospitalization. So RT-PCR test is done only when the patient is really sick. We need to educate the people not to think that COVID is over. So it has to be at the back of our mind, and still we have to see the third wave. And all flu-like symptoms, these illnesses have to be tested for COVID. Then only we will know whether it is a normal influenza virus or it's a COVID virus. Unfortunately, in all the peripheral parts of Bangalore, most of these general practitioners are unregistered, who don't even have a qualification, or some are from registered medical practitioners, self-styled. They're all administering even steroids, IV fluids, paracetamol at their clinics and telling people not to go to the hospital, which is a total violation of the COVID treatment protocol which has been prescribed by the state government and the government of India.
Let me go across to my colleague Srija, who's got us the story. Srija, very, very valid concerns there being expressed by the health officials. What exactly is the state government doing about this? Because if it's out in the public domain and people are talking about it, there must be some steps being taken in order to increase awareness.
Well, as far as Karnataka goes, we're looking at the death toll standing at least at about 35,000. This is the COVID death toll, which is ranking number 1 as far as the southern states are concerned, and also second in the country after Maharashtra. Now, having said that, we also have the health department confirming that nearly 50 to 60% of the COVID deaths are accounted for. This is only due to late hospitalization, or within the hospitalization, within the period of 72 hours, death occurs. And what exactly we found out was that most of the clinicians and also doctors at the clinic here, the first line of treatment has been wrong. And that's a clear admission coming in, not just from private hospitals and nursing association, but also the state government. Now, what really is the state government doing about this? Now, speaking to the health commissioner, he tells us that they have been conducting regular crackdowns, especially here in the periphery of Bengaluru and also districts across Karnataka. But is that really enough? Because now we are having a data which suggests that nearly 50 to 60%, if you're talking about 50 to 60%, now that accounts for nearly 15,000 deaths here in the state of Karnataka within 72 hours of admission where deaths have occurred. What's important to also note that is that Karnataka government, not just apart from conducting or carrying out the regular crackdowns, especially on unregistered clinics or quacks for that matter, we also had Dr. Prasanna stating the fact that, yes, it's been uncontrollable despite various decisions being taken by the IMA and also the state government. There are a lot of unregistered and quacks who are going unchecked here in the city.
Right, Srija, this is a very important story coming in from Karnataka. Hopefully, there will be more awareness about hospitalization and treatment protocol to be followed by anyone who shows symptoms. Thank you so much for joining us with that.